Sciatic nerve is the thickest, largest nerve in humans, branching from the lower spine and traveling through the back of each leg. As you see, this is the lower spine, and these are 5 nerve roots, L4 to S3, coming together to make up our famous sciatic nerve. Then the nerve runs posteriorly through each leg. Sciatica is a nerve pain originating along the sciatic nerve. However, it's a misnomer since direct injury to the sciatic nerve is quite rare. In fact, sciatica often develops when a herniated disc or spinal bone spur, irritate, or pinch one of the 5 nerve roots forming the sciatic nerve. As you see, this is a normal intervertebral disc, and this rope-like band is a nerve root coming off the spinal cord. When a herniated disc develops, it can exert pressure on the adjacent nerve root, causing sciatica in affected patients. It's usually felt like an unpleasant dull pain or burning sensation, starting in lower back and buttock and extending down to the ankle and feet. Sometimes muscle weakness is present as well. Thankfully, most cases of sciatica are resolved by self-care treatments. In fact, there are several important do's and don'ts helping us heal our back pain and sciatica fast and effectively. Let's start with some stretches generally known as extension exercises. They can effectively relieve pressure on sciatic nerve and ease sciatica pain. The first exercise is prone lying. Just lie down on your belly with your face turned to the side and your arms at your sides. Stay in that position for 2 to 3 minutes. This is the most basic exercise you can start with to ease that sciatica pain. If you can comfortably do so, it's time to proceed to the next exercise called the Sphinx. To do Sphinx exercise, lie down on your stomach again. Then align your elbows under your shoulders and lift your upper body up as far as possible. Stay in this position for 2 seconds and carry out 10 repetitions gently. This helps you restore your lower back's normal curve. Once it's done comfortably, move on to the third exercise called Cobra Pose. In order to do it properly, lie flat on your belly. Then straighten your elbows and push the upper back upward. Hold this position for 2 to 3 seconds and repeat up to 10 times. Another extension exercise is a standing extension. With this exercise, you should put your hands on your hips and bend backward while standing up straight. Make sure to keep your knees straight while doing the exercise. Hold this position for 2 to 3 seconds and repeat up to 10 times. It's so convenient and easy to do since you don't have to lie on the floor. Better to practice any of these exercises up to 10 times a day. Remember to perform extension exercises with gentle movements. If they cause pain in your back but not in your legs, it's fine. But if leg pain worsens, then stop the exercises. Unlike extension exercises, flexion movements can put extra pressure on lower back, causing further disc herniation and aggravating the sciatica pain. They include crouching, reclining, squatting, bent over row, and rotating the torso. Also keep in mind that bed rest has little or no advantage in improving the sciatica, while staying active as tolerated, like go walking and swimming, may relieve pain to some extent. The last important tip is to correct lifting technique to avoid a herniated disc and subsequent back injury. In general, patients with acute sciatica pain are supposed to avoid lifting heavy objects. Plus, always lift objects with your knees and not your back. In order to do so, keep your back straight and bend your knees to reach the floor and get the object. Then use your knees and not your back to stand up. With this simple technique, you are able to protect your back and spine. By the way, if you know any other movements that can relieve sciatica, let us know in the comments down below.